Welcome and thank you for standing by. At this time, all participants are in a listen-only mode until the question and answer session of today's conference. At that time, you may press star 1 on your phone to ask a question. I would like to inform all parties that today's conference is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the conference over to Ms. Gabriela Passat. Thank you. You may begin.
Thank you. Good afternoon, and thank you for joining us for the California Vaccines for Adults VFA program webinar. My name is again Gabriela Passat, and I'm joined today by my colleagues on the adult immunization team at the immunization branch. Together, we will be covering VFA requirements for year 2 of the program with a focus on what is changed from year 1, and hopefully this will provide you with the information you need as you embark in year 2 of the program. These are the topics that we will be covering today. First, the VFA program overview and a quick refresher on the patient eligibility criteria. Then my colleague, Christina Sapad, will go over the storage and handling requirements. Following that, Anya Gottman, our health educator, will discuss some of the existing as well as new VFA program resources with you. And I will then review the program requirements for year 2, again, focusing on what has changed from year 1. And at the end of the presentation, we made sure to allow plenty of time for your questions, and we also are going to be administering a poll at the very end, and Anya will let you know what the poll is about. So let's begin. The VFA program, as you know, is a new program that started back in June of 2016. The VFA program goals are twofold. First, to provide vaccines at no cost to eligible adults, accomplished via the expansion of access to 317 funded vaccines to you, health centers in California. And the second goal of the program is to integrate the standards for adult immunization practice into routine adult clinical care. And these standards are to assess the immunization status of all adult patients at every encounter, which means that providers have to stay informed on the latest CDC recommendations, and also that you need to implement protocols and policies to ensure that patients' vaccine needs are routinely reviewed and that your patients get the reminders they need about these vaccines. The second standard refers to providing a strong recommendation for the vaccine that your patients need, and there are very many elements that go into providing a strong recommendation, such as sharing tailored reasons why vaccination is right, highlighting positive experiences with vaccination, but also addressing patients' questions and concerns and reminding them that vaccines protect them and their loved ones against a number of common and serious diseases. The next step after providing a strong recommendation is administering the vaccine, and if you don't stock that vaccine or those vaccines, referring patients to providers in the area, so that's important, in the area, that offer those vaccines. And last but not least, document that the vaccine was administered, and if you referred out, close the loop and making sure that the patient has actually got the vaccine. And one last thing I wanted to emphasize here is that there is a reason, actually there are multiple reasons, why the National Vaccine Advisory Committee created these standards and why the CDC supports them. And you're probably very familiar with some, if not all of these reasons. Adult vaccination rates are extremely low, and most adults are not aware that they need vaccines. Also, there are many missed opportunities for vaccination because many healthcare professionals are not routinely assessing vaccination status. And now what I think is good news and something that you can actually leverage to improve adult immunization coverage rates, a recommendation from their healthcare professional is the strongest predictor of whether patients get vaccinated. Regarding program participation eligibility, listed on these slides are the criteria we created for that, and I will explain briefly why we have this criteria. First, participation in the VFC program means to us that the site has in place a certain infrastructure related to compliance with vaccine storage and handling requirements, vaccine administration, and the staff and personnel who know how to perform certain functions associated with this. For the second criterion, federally qualified health centers, rural health centers, and Indian health and tribal health centers are the settings where the population that we are trying to reach, that of uninsured and underinsured adults, accesses health care services. And for the last bullet, we want to be able to get data that we can use for program evaluation purposes, and we can only get this data if our enrolled sites participate in an immunization registry, such as CARE2 or a local immunization registry, or use electronic health record systems, which is a requirement for that's associated with the FQHC status. To give you an idea of how the enrollment for the VFA program looks like, in year one we enrolled 457 sites, and of those 440 sites belong to 108 FQHCs and FQHC lookalikes, and the remaining 17 sites are rural health centers, Indian health services, or tribal health sites. For year two, we wanted to address your feedback regarding being able to implement the VFA program at the organization level, so have a systems-wide approach. And therefore, we enrolled an additional 61 sites belonging to 24 FQHC organizations, and this is based on the feedback we received from sister sites already enrolled in the VFA program. And this was via the survey we conducted in June 2017. So now we have over 500 sites, and we're looking forward to working with all of you in year two. This is some of the data we got from year one of the program of number of doses administered by vaccine on the larger graph on the bottom. And as you can see, of the almost 70,000 doses administered, about a third were Tdap, followed by 4 vaccines that accounted for another third of doses administered. And those vaccines are in order: pneumococcal polysaccharide, hepatitis B vaccine, zoster vaccine, and the pneumococcal conjugate. In the insert, there's another graph, and this is also for doses administered, but this time it's graphed by quarter. And there was a small dip in quarter 3, and that's not the quarter 3 of the year, but quarter 3 of the VFA program, so that was January through March 2017. But overall, you see there the trend, and it looks good. The numbers are going up, and we hope to see the same trend and even higher numbers as we move into year 2. These are more of the program accomplishments from year one. No numbers this time, but plenty of good news here. Onboarding of 457 sites, development of many, many program resources that we heard from many of you are very helpful. We developed a system for you to submit reports, conducted key informant interviews with 16 VFA sites from 16 FQHC organizations that agreed to participate in these interviews and help the VFA program implementation in yet another way. And finally, we conducted a survey in June 2017 to which many of you responded, and the feedback we received through that was of great help in informing our planning for year 2. So I want to say that everything we have listed so far would have not been possible without your hard work to implement the VFA program in your sites and organizations. And on behalf of the VFA team, I want to thank all of you for your efforts and dedication to a very worthwhile cause. And just to make sure that we all know this, the impact that you are making extends beyond the VFA program. Through your work, you are creating an adult immunization infrastructure and an adult immunization culture, which is really a big deal. So thank you to all, and we look forward to working with you in the next year. So going back to the logistics and technicalities of the VFA program, this is a quick refresher of patient eligibility criteria for 317 VFA vaccines. Adults 19 and older are eligible to receive these vaccines if they are uninsured, so they have no public or private insurance. Underinsured patients who have insurance but the coverage does not include vaccines or covers only selected vaccines are also eligible for VFA vaccines. Under the Affordable Care Act, health plans must provide coverage for a range of preventive services, and you already know that. Vaccines are included among these services. The number of plans that were grandfathered in and are therefore not subject to this requirement is very small and will get even smaller as time goes by. So the underinsured patient population should be relatively small, and we will discuss some of the categories that fall under this in the next slide. So who is not eligible to receive 317 VFA vaccine? That is fully insured adults whose health insurance covers the cost of vaccines, even if their insurance imposes cost sharing, such as copayments, deductibles, or co-insurance for these services. Also, there are many differences between the VFC and the VFA program, but one that is directly related to patient eligibility is that unlike the VFC program where children with Medi-Cal can receive VFC vaccines, adults with full-scope Medi-Cal are considered insured and therefore not eligible to receive 317 vaccines. And that is because Boost Code Medi-Cal covers all ACIP-recommended vaccines, and parentheses here, they cover them as both pharmacy and a medical benefit. Also, note that seniors without Medicare Part D, as in dog, which is the pharmacy benefit, and who only have Medicare Part B, as in boy, which is a medical benefit, are considered underinsured for the purpose of our program. Part D, as in dog, covers vaccines such as zoster vaccine and Tdap, so seniors who don't have the pharmacy benefit, Part D, are considered underinsured and are eligible to receive these VFA vaccines. Because I keep mentioning ACIP-recommended vaccines, on the left here I put the recommended adult immunization schedule, on the top by vaccine and age group, and on the bottom by medical condition and other indications. So on the right-hand side, you can see these are the vaccines that are available through VFA. Most ACIP-recommended vaccines are available through the program. And this is the list of vaccines that are currently available for our program. Should the list change in the future, you will be notified of any change. And now I will pass the baton to Christina Sapad, who will go over the vaccine storage and handling requirements.
Thank you, Gabriela. So through our Vaccines for Adults program, the vaccines that we distribute to your clinics, they are purchased using Section 317 funds, which is why we often refer to them as 317 funded vaccines. So when you receive your vaccine shipment, you'll see on the packing slip that the number of doses for each product delivered is going to be designated, whether it's something from the Vaccines for Children program, if it's a 317 purchase vaccine, or if it's something that we provide with state purchase funds, such as flu. So once you receive your vaccine shipment, you want to ensure that you label your vaccine and store them in the pre-designated area of your vaccine storage unit. So in the picture on this screen, you will see that you may have a shelf that's designated for your VFC vaccines, a separate shelf for your 317 vaccines, and I know some providers may even store it in a separate vaccine storage unit if you have multiple storage units. But you also want to make sure that the storage units that you use, they all meet VFC program requirements. And because all of our VFA enrolled providers are VFC providers as well, you should already be familiar with the vaccine storage requirements. And there are key elements in storage and handling of vaccines. One of the first elements is to make sure that you have skilled and trained staff. So key practice staff or anybody at your practice that is involved with vaccine management, vaccine administration should be trained. And we have many lessons on our EZIZ website that the staff can take, such as monitoring storage unit temperatures, storing vaccines, administering vaccines. So those are good training resources for your staff to use. The other element for vaccine storage and handling is to make sure that your practice has written vaccine management plans. And these plans are that we provide is a good template to write down any emergency contact numbers. If there was an emergency such as a power outage, where would you transport your vaccines to? So the management plan templates are also available on our EZIZ website. It should be reviewed with your staff and updated annually. Another key element is to make sure you have accurate temperature monitoring equipment, meaning data loggers. So digital data loggers are required for all our VFC providers and VFA providers. So you want to make sure that you have data loggers that meet our VFC program requirements that can accurately monitor temperatures in your vaccine. So even though we distribute thousands of doses of vaccine to your clinics, we want to make sure that the vaccines that you are providing to your patients are stored properly and are the most effective in preventing disease. The other component is to make sure you have proper temperature monitoring and documentation. So it is required to document temperatures twice a day on our VFC-approved temperature logs. So these would be available on our VFC website as well if you don't have them already. So you want to document temperatures twice a day, even if you are using a digital data logger. The next component is to make sure that you have appropriate vaccine storage units. So same requirements as the VFC program, they apply to VFA. You want to make sure that you have equipment that meets VFC program requirements and can store your vaccines properly, and also have enough space to store your entire stock of VFC 317 and even your private supply.
Thank you, Christina. And now it's time for VFA resources, and the section will be led by Anya Gavin.
Good afternoon, everyone. So I'll be talking a little bit about the program resources that we've developed here, as well as resources through the CDC and the Immunization Action Coalition, some which are new and some which are existing. So also first I want to just point out that we've recently reorganized the VFA resources page so that you can more easily find some of the adult immunization and program-specific resources to assist you in implementing the program. So it's easy to get to this page. Just type in bit.do/capital V, capital F, capital A, and then lowercase resources in order to get to this page. That link is on the top top left-hand side of this slide. So the page is divided into 4 sections. The forms section includes the VFA eligibility screening record in English and Spanish, and then also includes forms to help you with various aspects of vaccine management. The second section you'll see contains many resources and job aids, and this is where you'll find job aids to help you with vaccine eligibility, such as the vaccine eligibility guidelines and the VFA program eligibility based on insurance status job aid. And then there are other resources to support you in implementing the adult immunization standards, as Gabriela mentioned. We encourage you to check out the top 10 strategies to increase adult immunization rates, which we recently developed, and discuss these strategies with your clinic teams. And then at the bottom, you'll also find the VFA webinar slides and recordings for all of our webinars in the webinar section. And then in the 4th section, you'll find all of our program communications that have gone out. And then another resource that we recently developed or have updated is the VFA program FAQs. And this you'll find under the resources and job aid section as well. And this resource will help you answer many of your VFA questions on topics such as your health center's participation in the program through eligibility, patient eligibility, and vaccine ordering, storage, and handling, and inventory. And the direct link to this document you'll see on the top right-hand side of this slide. And we'll be updating the FAQs as additional questions come in that we need to address. And there are also several materials available for ordering at the VFC store, and I have a link to the VFC store on the left-hand side up there. This includes the CDC's 2017 Adult Immunization Schedule, materials to promote prenatal vaccination, and a CDC flyer that provides patients with information about the vaccines that they may need to help you educate patients. And then also a double-sided flyer in English and Spanish that promotes pneumococcal vaccination for those who smoke or have chronic conditions. And then finally, a pneumococcal vaccine timing guide for adults to help you assess patients for needed pneumococcal vaccines. And also I just wanted to point out that the 317 stickers are available for ordering at the VFC store to help you with vaccine management. And now I'll point out, just to kind of remind you of some of the CDC's adult immunization resources. They have some great resources to help you promote adult immunizations at your clinic. You'll find patient-friendly immunization schedules, downloadable patient education materials, the ACCIP guidelines. And to check out these resources, you'll just visit the link on the bottom right-hand side. And you'll find the links to these resources for providers and for educating patients. In addition to the patient education materials, you'll also find that there's a lot of different template communications, such as web buttons and banners on your clinic to be able to put on your clinic website, such as the one on the top left-hand side there that says "Protect Yourself and Your Loved Ones." You'll also find radio PSAs, samples, posts for your social media sites, and a lot more to promote adult vaccines to your patient population in different ways. So you can visit the link on the bottom left-hand side to view these materials. And the Immunization Action and Coalition also, just to refresh your memory, has a lot of adult vaccination resources as well. They have job aids for administering vaccines, strategies to improve adult vaccine coverage, patient health education materials, and also patient-friendly schedules, and even more. So please check that out, that link. And then we also have the Immunization Action Coalition recently released a new resource. It's called Vaccinating Adults, a Step-by-Step Guide, and it's very comprehensive. It's free to download. It includes a lot of practical information to help you enhance your adult immunization services at your clinics. And while this guide has a lot of vaccine management recommendations, please make sure to follow the California-specific requirements for vaccine management as outlined in the VFC Provider Agreement, the Agreement Addendum, and the VFC Provider Operation Manual. We encourage all VFA sites also to subscribe to the Immunization Action Coalition's free online publication called IAC Express, and it has a wealth of vaccine recommendations and licensures information, important journal articles, and then other practical vaccination resources that have recently come out. And the link to subscribe to IAC Express is on the bottom right-hand side. So take some time to check out the different resources I shared with you today. Let us know if there's any resources you think are missing. We'd also love to know if you have developed your own resources and are interested in sharing with the group. So we'll be sharing our contact information at the end of the webinar. So now I'm going to turn it back over to Gabriela. Thank you.
Thank you, Anya. So now it's time to go over the program requirements, and as said before, with an emphasis on changes for Year 2. The first change is regarding the costs that patients incur when they receive a VFA vaccine. For Year 2 of the program, to ensure that VFA-eligible patients will not incur additional costs outside of any routine copay for the clinic visits, VFA program sites shall not charge eligible patients or third-party payers for the cost of the 317 funded VFA vaccines. So this is the same as in Year 1, and now what is different? Not charge a vaccine administration fee to eligible patients for 317 funded VFA vaccines, and also post a sign that states that free vaccines are available to adult patients who are uninsured or have insurance that does not cover certain vaccines. You also have to say that we do not charge these patients for getting the vaccine or for the cost of the vaccine. So we can provide you with a sign in languages that your patient population speaks and reads, and for that we have a poll at the end, and we'll talk more about it when we get there. But going back to the requirement, this is basically to eliminate any financial barriers for patients. And from our discussions with you in the past year, we know that many of you have been, without being required by the VFA program to specifically do so, you have been waiving the administration fee for your VFA-eligible patients. So we wanted to formalize this practice and make it a uniform requirement for all VFA sites. Regarding ordering and reporting, this is what we had in Year 1. So you're required to submit quarterly reports, and in this report you are asked for inventory and doses administered data and for program implementation related information. These reports were submitted by clinical sites, so one report per VFC PIN. They were not submitted by organization. And in Year 1 there wasn't a predetermined schedule for ordering VFA vaccine. Going into Year 2, we are requiring you to submit VFA orders quarterly. And just as in Year 1, orders will be submitted at the clinical site level, so one order per VFC PIN. There will be a 2-week window open in the beginning of each quarter, and you have those periods listed here, January, April, July, and October. And these are the times when you are going to be able to place a VFA order. And at the time of placing an order, you'll have to report, again, like in Year 1, inventory and doses administered data. Regarding reporting requirements, going into year 2, you will need to submit 2 evaluation reports. One at mid-year, so that's going to be an interim evaluation report due in July of 2018, and the final report will be due in January of 2019. Very important, and please remember, these reports will not be reports that you need to submit at the individual or clinical site level. These are going to be reports that your organization submits to us. And you will probably need to involve your QI person here because unlike year 2, this time, so for unlike year 1, for year 2 you will need to submit immunization coverage rates for 3 vaccines for your VFA eligible patients. So this is going to be in addition of some qualitative data that we're going to be requiring from you regarding the implementation of evidence-based interventions regarding the standards for adult immunizations. And again, you are going to be required to submit immunization coverage rates for 3 vaccines for your VFA eligible population. So although the mid-year report is not due until July of 2018, I think you might want to start thinking about planning on how to get this data and how to engage your QI people at your organization and get the baseline data so you know where you stand as an organization as you enroll in year 2 of the program. Regarding the way you had to document the administration of VFA vaccines in year 1, you had one of 3 choices: immunization registry, electronic health record, or the adult vaccine daily usage log. Going into year 2, the requirements are changed in that you are going to have to submit this data electronically, and I will show you what the options are for this. You also have to have a backup option, and you saw that in year 1 the log was one of the 3 options. Now you may enter this data in the log only after you enter the data in the EHR or the immunization registry. So that can be a backup and a secondary option, but primarily you have to submit this data electronically. So this slide looks a little ominous, but it's simple. The 2 options you have: 1, if you enter doses directly into your electronic health record, you are going to have 2 options depending on whether or not you're in a Care 2 region. If you are in a Care region and you are using Care 2 software, you will need to consult your EHR vendor and visit the Care IZ portal registration page, and you have the link here, because you need to ensure that you are setting up the electronic data exchange correctly to automatically populate Care with EHR data. If you are entering data in the EHR and you are not in a Care 2 region, so if you're in the San Diego Immunization Registry region, Healthy Futures, and the San Joaquin and nearby counties, or Imperial County Immunization Registry, the second bullet here addresses that. You will need to consult with your EHR vendor to ensure, again, that the data you enter in your EHR gets transmitted to the immunization registry. And the other option you have is, if you're not entering data in your EHR, you will need to enter doses directly into the immunization registry. And for Care 2, the VFA doses should be entered as 317 LHD HDAS doses. Now, regarding the documentation of vaccine refusal, we previously did not address this declination piece. We didn't have a specific requirement for you in year 1. For year 2, you will be required to document the patient refusal to receive a vaccine in the patient's record. And there is some additional information here regarding the Department of Healthcare Services requirement that Medi-Cal managed care plans document the declination in an adult patient's record in the form of a signed statement, and there's a link to the signed statement. You can take a look at it and see what the elements are for that. So to summarize, all the changes are ordering. For year 2, orders should be placed by each site, so 1 order per VFC pin during 4 open windows at the beginning of each quarter, and windows are of 2 weeks each. At the time of submitting the orders, you need to report inventory and administration data. For reporting, you will be required to submit 2 evaluation reports, a midterm or interim report due in July 2018 and a final report due in January 2019. The reports will need to include data on implementation of evidence-based interventions related to the standards for adult immunization practice, and different from year 1, you will need to report on immunization coverage rates for 3 VFA vaccines. For documentation, for year 2, you will need to document vaccine administration electronically, and you will also need to document vaccine refusal in the patient's record. And last but not least, regarding fees, you shall not charge for the cost of the VFA vaccine like you haven't in year 1, or its administration. This is new, and you should also post a sign with language provided by the immunization branch regarding that. These are some next steps and important dates. The next open order period is January 2nd through the 16th, 2018. We are going to be posting the webinar slides and recordings in the next couple of days, and you are going to be getting a notification regarding that. All the program requirements will be posted in January 2018, and should there be any changes from anything we've discussed today, you will know about it. We will make sure to notify you. And the next webinar tentative date is March 2018. We are going to focus, at least in the next couple of webinars in 2018, on evidence-based interventions as they relate to the implementation of adult immunization standards, so talking about reminder recall, adult immunization champions, provider reminders, and so on and so forth. And very important, please make sure that you start planning for your evaluation reports, start thinking about how to gather baseline data and how to get those numbers. So I'm going to pass the microphone again to Anya, and she will talk to you about our sign related to vaccine fees.
Great. So we have, in order to help you to meet the VFA Year 2 requirement regarding vaccine administration fees or no vaccine administration fees nor cost for the vaccine, we have created a mock-up of a sign to let the patients know that they will not be charged for the cost of the vaccine or the administration of the vaccine, as mentioned. It also includes check boxes that you can check next to the corresponding vaccines that you offer in your clinic to let patients know which vaccines you offer. And as Gabriela mentioned, the sign needs to be posted in a place where it's clearly visible to patients. Some examples are at the front desk where patients check in or where you take vitals. And so to make sure that all of your VFA-eligible patients are aware of this change, we were planning to translate this sign into the languages other than English that your patients most commonly speak. So take a minute to look at this sign and think about the languages that your patients speak other than English. And we're going to move to a polling question to find out what are the top 3 languages besides English that your patients most commonly speak, so that we can think about translation or start translating this sign so you have it available. So we're just going to take a few minutes to shift to the polling question. We'll give you a minute to answer that.
So I'll give you a couple more seconds, and then I'll have to stop sharing, and keep your fingers crossed for us. Hopefully the polling question will work. So take a look at the sign, and then we'll show you the options for the language. So you should see now the questions, and I see that many of you are already answering.
So while we're waiting for the poll to close the poll, reminder, I think there have been some comments that we've heard that the visual portion, some folks are able to get onto the phone call but not onto the WebEx.
that the intention is to post the slide set with the audio portion in the next day or so. So the full set will be posted, and we will send out a reminder email to all VFA sites once posted. Okay, so it's currently telling the results. Bear with us as it tallies the results. Okay, so
I'm sorry. So I think we are sharing the poll results with you. You should be able to see them.
It looks like, not surprisingly, Spanish is one of the top answers, as well as Chinese, Mandarin, and Vietnamese, and Arabic, I believe, are the top answers.
Great. So thank you for giving us the feedback on this. This is very helpful, and you'll hear from us in the next month or so with more details on the sign and this translation. And I think now we are ready to start answering questions.
So, operator, if you'll go ahead and queue us for questions, and you can go to the chat box to see if anything has come in.
Thank you. We will now begin the question and answer session. If you would like to ask a question, please press *1, unmute your phone, and record your name clearly. Your name is required to introduce your question. If you need to withdraw your question, please press *2. Again, to ask a question, please press *1. It will take a few moments for the questions to come through. Please stand by. Our first question comes from Ida Campbell. Your line is open.
Yes, good afternoon. I have a question regarding the Part C, if I understood, or the it's a program for the HIV patients, those that have Ryan White. Did you say that they are now eligible for VFA?
It's a great question. We have been trying to find out and have been trying to get more information on that. And at this point, we have not received confirmation that it's considered insurance. So for now, we're saying that you do not consider Ryan White as a form of insurance that covers vaccines.
So now that we are able to use VFA vaccines for Ryan White patients.
Right.
Okay.
Well, we've been pursuing this at the federal level and have yet to really get clear information on that. And so I think until we know for certain that it is a covered benefit, then it's safe to assume that it's not.
Okay, so we cannot use it then because you're still considering it a covered benefit?
I'm sorry. I apologize for the language if it's not clear. We do not consider Ryan White a form of insurance that covers vaccines. Therefore, the patient is considered VFA eligible.
Okay, thank you.
Okay, I'm sorry. I know, it's very confusing.
Thank you.
The next question comes from Marina. Your line is open.
Hi, this is Marina Sidman from Queens Care Health Centers. I actually have a few questions. So we have 2 sites that are year 2 and 2 sites that are year 1. So is there different ordering time frames between the sites? I mean, I'm trying to keep things universal.
Hi, Marina. No, there's not a different time frame, and we just try to make this more uniform for everybody. We noticed from year 1 that most of the people placed 4 orders in year 1, so we just wanted to keep everybody on the same schedule, so year 1 sites are going to be on the same schedule as year 2.
So the sites are all now in a year 2 framework for VFA.
Okay, so the next ordering period is the first week of January?
Yes,
for all sites.
For all sites, yes.
Okay, and then what happens if they miscalculate and don't have enough? Is there a way to place like an order in between, or you're out of luck?
Hi, Marina. So we may consider it on a case-by-case basis depending on, how close are we to the next ordering period, how much you have left, and what your usage is for the VFA vaccine. So you can certainly email at that time the My 317 vaccines email and with your PIN number at that time if you do need vaccines in between the ordering period.
But the blackout period begins tomorrow. So, right? So there will be a period where there won't be any vaccine deliveries for the week.
Well, for right now, for VFC vaccines, we told providers that to place their order by yesterday in order to get their routine shipment on time before the holidays. So this would mostly apply for when the new year starts, when we do our quarterly ordering period.
Right, because I think for one of my new sites, they miscalculated and they wanted to order extra, and they tried to place an order a couple of weeks ago or last week, but I wouldn't let them.
Yeah, well, so what will happen with the quarterly order system, so the 317 order button will be visible during the 2 weeks. So you want to make sure that when your practices order to prevent this situation, is to make sure that each site is ordering enough to last them for that quarter based on historical usage and any current 317 inventory that you have on hand.
Okay. Is there a way to place an order today by any chance or no?
Not today because of the blackout period for the holidays. Our national vaccine distributor, we cannot place any more routine orders because of the holidays, they will not be delivering vaccine. So unfortunately, no.
Okay, thank you.
Marina, I have a question for you. So did the site that needs an extra order, did they go already through all the vaccine doses, or they're just trying to be extra cautious and order a buffer?
They've gone. So last week, one was they needed Tdap, and so we originally ordered 50. As of last week, they had, I think, 3 left. It said over-ordered or something, so it wouldn't let them. I mean, I don't think it was ever confirmed. That's one, and then we had initiated another site with a temperature excursion, and the CMA that was reporting the temperature, so I think you guys are not allowing them to order as well. I had ordered them a new refrigerator. I'm just trying to figure out if they're able to order come January.
Yeah, so with storage incidents, we want to make sure that you have the proper equipment to store the vaccines before we send you any more. So if they just purchase a new refrigerator, we want to make sure that it's holding the proper temperatures, because the last thing we'd hate to do is if we send you vaccines but the refrigerator is still malfunctioning. So we want to make sure that your unit is in place and it has the temperatures. So that's another reason why an order might be held. But come January, hopefully you said you have your new refrigerator ordered, and once it's holding temperatures, and then the order button is available in January, you can place an order for that practice.
Okay, perfect. Thank you.
As a reminder, if you would like to ask a question, please press *1 on your phone and record your name. Again, your name is needed to introduce your question. The next question comes from Rosa. Your line is open.
Hi, this is Rosa. I'm calling from Hillmark Community Health Center, and I just had a question. For the Spanish form that you had submitted for us to check the languages, I was wanting to see if there was any way we could add the Punjabi and also Portuguese. I didn't see any language checkoffs to see if we could get those.
We didn't add Punjabi and Portuguese since it wasn't noted as one of the two, or some of the top languages that are spoken in California. I believe if there are other people that are interested, please email us and let us know, and we can take that into consideration.
Okay. Thank you.
And we do have 2 questions here via WebEx. One, I wanted to know if there are guidelines for which that shows the insurances that cover vaccine, and we do have a document on the EZIZ VFA page that Anya showed earlier that at least has a template for the Medicare benefits. I think what you're talking about might be some of the county-specific health plans and whether or not they cover vaccines. And I think we have a link, a web link to the list somewhere. So we'll make sure that that's more visible on the website. And let's see, would it be possible to create a vaccine swap or vaccine available to share with other clinics, just in case a clinic has vaccines that are going to expire and the clinic is unable to use? So we, again, are encouraging clinics to order an amount appropriate for a quarter use, and that if you do have doses that you don't think you'll be able to use, please contact your senior field rep, let them know, and then you can also look at the other VFA locations within your organization. We'd like you to start there first because we know that the VFA sites will have the appropriate storage and handling, and so transfers in that sense are fine, the one-time transfers.
And sites can also transfer to LHD. So we have a question right now in the frequently asked questions that Anya mentioned that we posted on our VFA resources webpage, and we actually have a question on this. So exactly like Nisha mentioned, look to have a strategy in place to make use of these vaccines. If you don't have that, then you have to contact us, and we can guide you toward a local health department or to a VFA site in your organization.
And then the next question is CARE2 and EHR enough for backup if the EHR is down, or do we need to have a paper copy as well? I think CARE2 is fine, but I'm assuming that if your EHR is down, oftentimes you're unable to really get into CARE2 as well. But if you can get into CARE2, then it's perfectly fine to record doses there as well in the event that your EHR isn't up and running. Operator, do we have any other questions?
Our next question comes from Maria. Your line is open.
Hi. I just wanted to know if we're able to add the language for Cambodian in the system.
We did have Khmer on the list. So, well,
no, I meant Cambodian.
I'm sorry. So you were saying that you'd like to add Cambodian to the list. Is that's a patient a language that many of your patients speak?
Yes.
Yeah. Okay. Yeah, I guess similarly to Portuguese and Punjabi, it wasn't on the list of top languages that are spoken in California, but if there is interest from others, please email us and let us know. Thank you.
Okay.
Oh, my colleague is telling me that Khmer is Cambodian, so
it is covered.
So it was included on the list.
Khmer?
Yes.
Okay. Thank you.
And then we have another question about reporting 3 vaccines, and I'm not really, what?
So that's for the evaluation reports. You're going to have to report immunization coverage for 3 vaccines.
Yes, okay.
And we are going to give you the option of just choosing what vaccines work for your clinic. It depends on your patient population, your location, everything. So we figured that for this year, you can do 3 vaccines of your choice. VFA vaccines, obviously.
Next, we are currently experiencing issues with data accuracy in CARE2. We feel this will be a barrier to VFA program participation. Is CDPH working with CARE2 on system improvements for data accuracy? And the answer is yes, we certainly are, and we do understand the growing pains of working with CARE2 and getting the doses in, and CARE2 is working very hard on data accuracy. And that as long as you're putting it in your EHR, then the hope is through data exchange, the doses will get into CARE2. So we hope that we'll continue to work with CARE2 on improving accuracy and data transmission into the registry. And I think, tying into that, can you clarify the documentation change for year 2? Will it be mandatory to document an EHR and healthy futures? I think it's supposed to be or. So what we're now saying for year 2 is documentation needs to occur electronically, so either in your EHR or in your registry. So it can be healthy futures or it can be Care 2 or SDIR in San Diego. Okay, so the next question is about sharing between sites. Can VFA increase promotion of sharing? I experienced great difficulty with getting clinics to take vaccines when contacting other VFA providers. I think they feel uncomfortable receiving vaccines from another clinic. Well, we do not like to actively promote sharing because we don't want to compromise the vaccine moving it from location to location. We do understand that there comes a time when doses are on the verge of expiring out, and we do want to see them used and not wasted. So we don't do any active promotion of sharing. We can do, though, is if you know far enough in advance that it's likely you won't be able to utilize all your doses, to talk to your senior field rep, and we can start figuring out how do we get these doses moved. But again, we're hoping that a year into the program that you're now able to accurately order doses that you can utilize in a quarter, and we're hoping that the longer ordering period will help too. Okay, let's see. Do we have any questions on the phone?
Next question comes from Jessica. Your line is open. Jessica, your line is open.
So my question was actually answered over text message, so I'm good.
Okay. Thank you.
The next question comes from Katie. Your line is open.
Okay, hi. I was wondering if the VFA vaccines that are like the Gardasil, the HPV, the MMRs would be able to be used with the VFC program?
No, the vaccine should be kept separate and is meant for uninsured, underinsured adults. So VFA doses should be kept separate from VFC.
Okay, perfect.
And then I think there's a comment about sort of the EVAV site having information for both VFC and VFA providers. We've been trying our best to sort of keep them separate. I think the problem that we run into is there's a lot of underlying commonalities between the two, and so that's why VFA is hosted off the site. But we are trying our best to sort of keep VFA information on a separate web page. But your feedback is helpful. And then from now on, the reporting will be done through our EHR data. So I think what will happen is that the report will come out, and then we will be asking you for information that can be pulled from your EHR. So it isn't necessarily an EHR report, but it's likely that the data we want, you'll have to run some sort of report in your EHR. For eligibility, if we record all the required info in our EHR, do we still need to complete the paper eligibility form and scan into our EHR? No. If the information is already in the EHR, it only needs to be recorded once. Let's see, is the EHR sufficient for eligibility screening, or do we have to keep paper records as well?
So it depends on how I would say how your EHR is set up, because I don't think that all of you have the capability of setting up your EHR to verify VFA eligibility. If you do, then that should be enough, but if you don't, then I'd say use the the form that Anya has showed you.
Then, well, we have transfer forms online for VFA. So you would utilize the same myVFCvaccines.org homepage to submit any transfers, and because you are all designated as a VFA provider, you would select on the first page whether or not you are transferring 317 vaccine or VFC vaccine. So you would select if you are transferring VFA 317 funded vaccines, you would select that 317 button, and from there, that'd be your way of documenting online that you've done a transfer to another 317 or VFA provider. So again, your transfers are discouraged, but if necessary, you would document that on the online form that you transferred to another 317 or VFA provider. And do we need to have two different temp logs effects for the vaccines if the vaccines are kept in the same refrigerator for VFC and VFA?
So you do not need to have two different temperature logs if the VFA and VFC vaccines are stored in the same storage unit. One VFC-approved temperature log would suffice for that unit.
Will today's PowerPoint be available to print? Yes, we hope to post it in the next couple of days. Will Shingrix become available for the VFA program? What a great question. It likely will be. These doses are available through the federal program, so a federal contract has to be set up first between GSK, and once that's done, that usually takes 2 to 3 months. I assume probably sometime in early spring we'll know more, and at that point we'll see about limited availability of Shingrix to VFA sites. And then are we supposed to register the vaccines online with CARE and EHR, or as long as it's in our EHR? So I'm not sure what you mean by registering vaccines, unless you're talking about recording inventory, but there isn't really registering vaccines.
If there are any other questions on the phone, I think we might have time for 1 or 2 more questions.
The next question comes from Samantha. Your line is open.
Oh, I'm sorry. My question was already answered as well. Thank you.
If you wish to withdraw your question, please press *2. The next question comes from Cynthia. Your line is open. Next question comes from Patty. Your line is open.
Hi, yeah, I just wanted to clarify the eligibility for the patients with Part D Medicare. Do they have to not have Part D but have Part B?
So patients with Medicare Part B, as in boy, have the medical benefit only, and the medical benefit covers pneumococcal, covers Hep B for high and medium risk, and it also covers flu, but that's outside of the VFA program. So if they have only Part B, they will be covered for those vaccines. If they don't have the pharmacy benefit, that's Part D, that covers other vaccines like zoster and Tdap, and most of your patients will have Medicare Part B as in boy, but not Medicare Part D as in dog, because they have to pay extra to get the pharmacy benefit. So those patients will qualify for VFA vaccines for the Part D, so the zoster, Tdap, and that is for Medicare patients who have Part B and don't have any other insurance, so there wouldn't be many patients.
Oh, okay. Okay, thank you.
Sure.
The next question comes from Manuel. Your line is open. Manuel, your line is open. The next question comes from Serenity. Your line is open.
Hi, yes, I have a question. Where will we find the evaluation report?
We will provide you with the template. So given that the interim report needs to be submitted in July 2018, we just wanted to give you a heads up on what the data you'll have together will be like. It's going to be a pretty simple template, and we will be providing you with more data as the 2018 starts. And,
okay. And then tied into that, the 3 vaccines we decide to report on, what do you mean by coverage rate? By coverage rate, we're actually talking about immunization coverage. So what we'll ask you is
as you pick a certain population, how many folks are vaccinated within one population, and then you'll do that for three vaccines. I think that's all we have on WebEx. Do we have any others lined up?
We do have a question from Maria. Your line is open.
I wanted to know, are you going to do audits in the future, like we audit the VFC for immunization rates on the VFA?
So given that the VFA program is much newer than the VFC program, we understand that it takes a while for you to get, started on it and have everything in order. We are right now trying to, it's just the second year, so we're trying to do the best with what we have, limited resources on our side, on your side as well. So we're trying to see, start with getting reports from you, and we're giving you a choice on 3 vaccines that you have to report on. I think that data should be relatively easy to get, at least what we've been hearing from you. We administered the survey back in June, and we asked you about your capabilities in terms of getting those reports, and most of you said that you have those. So that's what we're trying to get right now. And we are going to also be talking about the evidence-based interventions and how we can best support you to get your workflow started and your evidence-based interventions that work for your specific clinics in place for year 2. So right now, that's what we're focusing on, and further down the line, I cannot tell you, but hopefully this is enough for now.
Thank you.
Okay.
We do have another question from Adriana. Your line is open. Adriana.
Hi, I just had a question. Just want to confirm that the log sheets that I think this question might have been answered. We don't have to keep an actual paper copy if it's in our EHR.
If you can enter the data in your EHR or CARE, so that is, we're asking you to submit the data electronically. It can be either EHR or CARE, and if you have an issue with your system and you cannot recover the data, then if you have another way of getting the data from your system outside of the log, then you don't have to keep the log. So,
okay, because the log sheet that it's on the website, it has like a daily count, a weekly count. I just want to make sure that if you're doing a quarter report, then we should be okay with just having the EHR report, unless you are looking at dailies that you want. You're going to not be calling me or be like, can I look at that log sheet?
Or I think you're referring to the data that you have to administer at the time when you submit your orders.
No, it's the actual log sheet for.
But it says quarter reports.
Well, yes. Do we have to? It's just kind of tied in the question. Do we have to submit those paper forms as part of our quarter reports, or you don't actually have to do that?
No, you don't have to. No.
So the paper form is more of a backup if you can't access your EHR or the recording in your EHR CARE.
Okay, sounds good.
The next question is from Agnes. Your line is open.
I have a question. We have a lot of patients who come in that are uninsured. We send them to member services, and then they qualify for Medi-Cal, which goes back 45 days. How does that affect VFA vaccines?
That is a very good question, and we might want to maybe talk offline with you. If you can send an email to my317vaccines@cdph.ca.gov. It's the first time we hear this question, and I think we might need to get more details from you.
Okay. Thank you.
Thank you. And I think we have to stop here. It's 1:04. Thank you all for the really great questions, and feel free to send emails to our My317 Vaccines address and call any of us to request any clarification. So thank you all for joining today, and happy holidays to you all, and you'll hear again from us in the next couple of weeks. Thank you. Operator, I think we're ready to end the call.
Thank you. That does conclude today's conference. Thank you for participating. You may disconnect at this time.